Hi everyone, welcome to Mom Talks. We are continuing our discussion this week on common health concerns, different things that are very, very common, especially in wintertime, things that if you haven't seen it in your own children, you would probably have seen it in some of your friends' kids, or it's just so common, it's so out there, we're talking about it all the time. So right now, today we're going to be talking about RSV. You've probably seen it all over the internet. Doctors say don't kiss the babies. It's RSV season. And we have Dr. Katie Leonard here in our St. Louis Children's Hospital Emergency Department. And you and I were just talking about it, and we're seeing that right here in St. Louis. We're seeing an uptick.
Yes, it is RSV season. We usually see it sort of November through April. So now a lot of cases are picking up, and I expect they will continue to as, people are inside more, traveling more around the holidays.
Yeah, the temperatures are dropping here in St. Louis, at least today, so people are coming in, close quarters, Christmas is coming, and so people are going to be in there tight. We always talk about RSV with little babies and very small children. Can we start by talking about what RSV actually is?
Yes, so RSV is a cold virus, essentially, and it affects babies differently than it does adults. Because in little kids, we think of RSV as causing, it starts out as just an upper respiratory tract infection, so all of the symptoms you would see with a common cold, congestion, runny nose, a little bit of cough. And then after 2 or 3 days, the infection travels down into the lungs, and then it's a lower respiratory tract infection and causes bronchiolitis. A lot of viruses can cause bronchiolitis, this lower respiratory tract infection. RSV just is the one we see most frequently, most predominantly in the winter.
And it's kind of a scary one because how it'll oftentimes present itself as your little baby having trouble breathing, and I know that's terrifying for new parents of young children. So we'll be getting into that. So let's talk a little bit about how it's spread.
Snot, coughing, secretions.
You heard it here, folks. Snot.
Spewing everywhere. Little kids touching everything.
Oh, they don't do that.
Putting their hands in their mouth. Every way, just kind of the flu and other common colds are spread.
So let's talk a little bit about what makes it especially concerning for babies and premature babies, especially.
Yeah, so kind of any babies, we talk about it causing the lower respiratory tract infection in kids under ages 2 or 3. And so what you'll see is all the kind of snot and mucus that you see in the first couple days pouring out of their nose and making them cough and choke and gag while they eat. All of that ends up getting produced down in the lungs. And so when we suck their nose out, we can get rid of it when it's up here, but there's not much we can do for it down there.
Yeah.
And so then you're right, what we see is them working harder to breathe because they're trying to move air past all that mucus clogging up their lungs. And then premature babies whose lungs aren't even as well developed and are still developing are just hit a little bit harder because they're more fragile, more inflammation in those kind of premature developing lungs.
Yeah, and with premature babies, a lot of times their lungs haven't fully developed yet when they were born, so imagine that plus an infection. Just not good. So I think when parents are looking at their child and they're concerned that their child might be having trouble breathing, what should they be looking for?
Yeah, so the first thing that we look at too is how fast they're breathing. So if you're trying to figure out if your baby's breathing too fastly, we say, do a stopwatch or look at the clock and count how many breaths they take in 30 seconds and times that by 2. For most babies, if they're breathing 50 to 60 times a minute, that's pretty fast and they should probably get checked out. If they're consistently breathing that fast, they're going to be giving you other clues too. So a lot of babies kind of use their stomachs when they breathe normally, but if they're breathing that fast, you'll see them using their stomach muscles, sometimes the muscles in between their ribs on their chest. They'll also kind of tug with their muscles up here, and then sometimes you'll see their nose flare, they'll have head bobbing and grunting, and they're really it looks like they're using their whole bodies to breathe, and they're doing it fast. It doesn't get better if you just suck out their nose, and that's when they should be seen by a doctor.
So let's go into, I think a lot of parents have trouble kind of discerning when is it okay to just be like, okay, I know you're having trouble here, but we can go to your pediatrician first thing in the morning, or let's get you in, let's get you seen right now, let's go to the emergency room, let's go to an urgent care center. So how can parents kind of make that call? what should they be thinking about?
Yeah, and it's a hard call to make. We
Yeah,
acknowledge
it's
that. So
scary.
we see a lot of babies, who are, yes, I see why you brought them in. They're breathing fast and not normal. And sometimes they're on the spectrum of they're not bad enough that we're going to do anything about it yet. But, here's what it would look like if it gets worse. But so I think, how do you make that decision? If you're seeing some of the clues we just talked about, we say, first, make sure they don't have a fever, because RSV is a virus that can cause fevers too, and anytime your fever's high, you're breathing faster and harder. So Tylenol or ibuprofen if they're old enough, see if with their fever coming down, their breathing slows down. Also, suctioning out their nose really good to see if that helps. And if those things don't help and they're still breathing, again, that kind of 50 to 60 times a minute and using those muscles, that would be the time to get them checked out.
Looks like we have a question. I will remind everyone we are taking questions. Like I said, RSV is a tricky one. It's a scary one. It's also one, like we talked about, a lot of judgment calls here. So if you have questions, please send them in. But looks like we have our first one.
Somebody from the audience wants to know, what are some of the things that a parent can do to prevent their child from getting RSV?
Yeah, so let's back up a little bit. So prevention.
Great question. Hand washing and avoiding people who are sick. Kind of any child, adult with what looks like a common cold could be RSV, just causing a common regular cold in an adult. And again, the little kids just get hit harder by that particular virus. So carry hand sanitizer around, wash your hands religiously, wipe your baby's things down, especially if they're in the age where they're shoving everything in their mouth, and try and keep them away from sick people.
So let's talk a little bit about treatment. So for starters, if a parent brings their baby to the emergency room, is there anything special that can be done in the emergency room to get that, to help out with that maybe you can't do at home?
Yes, and again, it's kind of a spectrum. So we always start out by making sure the nose is sucked out really good, and we have this wall suction that really gets the snot out well, and that's something we can do that you can't do at home. But steps at home are either bulb suction or the nose Frida is
it's
great.
Gross, but it
trying
works
to get all the snot out. But that's always our step one. And then the other things that we look at, again, are just overall how fast and how hard the baby is breathing. That helps us decide if do they need oxygen, do they need extra support, which we call high flow oxygen, which really kind of pushes air more forcefully into the airway past all of the mucus. And that's the main treatment that we have for RSV. We know that breathing treatments don't really help. There's no, unfortunately, antibiotic or medicine that makes the virus go away. So it is all a spectrum of supportive care and just helping them clear as much mucus as they can and giving them extra support, moving air in and out if they need it.
Is there anything else that parents can do at home? You said suctioning out, medicine that can be given, other types of treatments. Is it true that you can take them outside and see if it helps?
That's more for croup
Okay.
and RSV. And croup's kind of a whole different situation.
Yeah.
That one you'll have a barky cough and a noise that they make when they breathe in, like
right.
And so that's due to some swelling of the upper airway, and we think going outside helps. With RSV, not so much. We always kind of say you can try things that it might help but won't hurt, are things that we say might thin out the mucus. So humidifiers or standing in a warm shower before bed to just kind of get all of it out. The same as any adult with a ton of snot would do. But there's not really any medicine. There's, cough and cold medicines aren't safe for kids, and it's not going to help. The virus just kind of has to run its course and support them how we can.
So one thing about RSV that makes it kind of scary is, if it gets really bad, it can progress into other more serious infections. Can we talk a little bit about that?
Yeah, and RSV on its own, just depending on the age of the kid and how their lungs react, in of itself can be very serious, and sometimes need more respiratory support than what we even talked about. But just like any kind of virus, after a while, all that mucus sitting there can turn into a bacterial infection like pneumonia or ear infections. So, if you're having prolonged high fevers, the baby just doesn't look well, those are other reasons to get them checked out and make sure there's nothing that we can use an antibiotic for.
Right. And for that, would you start with just pediatrician, or would you come here?
I would say always start with your pediatrician
Sure.
if it's during pediatrician hours, because they can help you make the decision, is it worth it to go sit in the ER? But if it's the middle of the night and the kid looks ill, definitely the ER. If it's just a fever and you're like, this has been going on for too long, but they can wait till morning, I would wait till morning, but it's hard to.
Sometimes when in doubt, just trust your gut and just go over
absolutely.
here. So
I'm a mom. I'm always
Yes.
in the middle of the night. It's the hardest to like make those
Right.
decisions. So
but then sometimes it's just like you feel them and you go, get in the car. Here we go. So. All right, well, that's going to wrap it up this week for Mom Talks. Thanks for joining us. I do want to add that if you, for more information on RSV and also croup, which we brought up very briefly, we're going to be putting a Mom Docs video by Dr. Kristen Bruno in the comment section of this video. So it goes into both of those illnesses, how to treat, lots of things that we covered here. So if you're just looking for more, you can click there as well. Next week, we will be talking about another great fun topic, very highly contagious. We'll be talking about pink eye, what causes it, how gross it is, and how to get rid of it. So you will definitely want to tune into that. Have a great weekend, everyone.